We are around 15 miles west of Davenport and west of Palmer College. We're on Route 6 headed west, and we're headed to visit Mickey Burt in his practice. Now, Walcott is a small farming community. It's about 1,600 individuals, and it's pretty amazing that Mickey's clinic, which is a large chiropractic clinic with Mickey's practice as well as full-time practices of his three sons, all in this same building, and they stay very busy in this small farming community. Here's his practice on the left, and again, it's closed now, but they might have some staff and a couple of the docs still in here. We're going to meet Mickey and talk to him about how things have been going. We're here at the Mickey Burt Clinic today. As mentioned, I wanted to show you what a chiropractor in the field has done to ensure the safety of his patients and his staff during this COVID-19 pandemic. So I'd like to introduce you to Mickey Burt. Many of you, of course, know Mickey Burt. He's been a longtime alumnus at the college and very active working at the college in the alumni area, as well as active as a practitioner and a mentor for many in our Palmer community. So let's meet Mickey and talk with him about what he's been able to do during this time. I won't shake your hand given our circumstances, but I really appreciate you having us out today, and your lovely wife Carla, who's been here. Now, how long have you guys been at practice here at this location?
This location we moved in 1981, so we've been here for, what, 39 years? In this building here.
But you practiced in another area prior to this?
Right by the post office.
We had a smaller office, and we started in the fall of 1974. So we've been here, what, 46 years now? Yeah.
And I think I saw a grandson running by, so between
Dylan,
daughter-in-laws and grandsons, it's a family affair here.
Dylan is my scribe, and Dylan's been with us for a couple of years now.
Yeah.
Dylan is
Dr.
Chad's oldest son, and he helps me.
Did you hesitate? Did you think maybe we need to shut down for a period of time? Or
day one, we said we are essential care. We are part of what it's going to take for our community to get through this and to get it through safely. They depend on us. The other thing that we quickly realized is that, a lot of medical doctors' offices were closing down. They weren't doing any more surgeries. They weren't doing any more, a lot of PT facilities were closing down. Everybody was closing down. There was nobody there to take care of people from a musculoskeletal standpoint. And so, we're there. And this morning, we had a very busy morning. I mean, all three doctors were working, and we had a full schedule. And I gotta be honest with you, nobody was in the office this morning for what we would call well care. They all needed our care. And that's what we've been seeing over the last couple of months is that people coming in because they just can't wait. They need to get adjusted. And we realize that. And so one of the things we want to do was take a look at what the CDC was saying and the National Institute of Health, and saying, okay, what do we have to do to create a healthy environment for our patients? So the first thing we did is we took the waiting room, and we took out about half the chairs in the waiting room. And so there was social distancing in there. And to be honest with you, as things start ramping up, and we know this next month we're going to start doing that, because we're already seeing that as we got closer to the end of April, we were seeing more and more people coming in. So our question is, how do we do social distancing? We've also had, instead of a sign-in sheet, we have a series of questions that we ask them is are there any symptoms? Do you have any fevers, any known exposures, or any travel? And they've got to answer no to all of those, and we take their temperature. Nobody comes into the office without getting their temperature taken. Staff, they take their temperature at the beginning of every shift. The doctors take their temperature every day. The staff goes through and sanitizes the office. In fact, we even went to the point, and 2 weeks into this, we had a professional company came in, and they sanitized and cleaned all the upholstered furniture, carpets, and so forth throughout the whole office. You either wash your hands between patients, or when you walk into the room, you sanitize your hands with every single patient. So we try to create a nice, safe environment for them. We divided the practice into 3 groups of people. Group number 1 is what we call well patients. Okay, they've not been exposed. they're not having any issues or anything like that, and they come into the reception area. Then we take our high-risk patients, whether they have asthma, heart disease, they have complicating healths, in other words, they have fragile health issues. We have them come in through a back door, side door where the staff comes in, and we have a special seating area for them to be in, and we make sure that nobody's in that area when they come in, and then they have a direct movement right into an adjusting room, right from that seating area right to an adjusting room. Then we have another entrance, which is the very back entrance, and that's where our rehab area is, and we've turned that into a COVID-19 room. It's set up with everything that we have. We have a portable table for our pelvic bench work. We have a chair that is gowned and changed and cleaned all the time, table sanitized, and then they come right through a completely different door with a parking lot in the back, so that we can bring them into the clinic. And this door is closed that we're standing by right now. They're completely isolated from everything else. The rehab area is not being used at all for anything other than just our COVID-19 patients. And so all of our nurses and healthcare practitioners that are exposed, have been exposed to COVID-19, we can take them into that area, and then we glove up and gown up and mask up, and we can take care of them because they come in and they've got their masks and their gloves and stuff on because they don't want to spread it, but they still need the care.
It was kind of quiet in the very beginning when this all started, and we were kind of sitting around here twiddling our thumbs, and then we thought, well, you know what, maybe patients don't know that we're open and thinking that we're closed. So Dr. Brad sent out a mass email to all of our patients, and then the phone started ringing and people were saying, oh my gosh, you're open? I'm like, yes we are, haven't missed a day. Oh, and then the patients that have come have said, thank you for being here. I am so glad. I needed it so bad.
As our governor has started to reopen counties, in fact, yesterday, of the 99 counties in Iowa, 77 of them went into the first phase of reopening. Do you have a sense that that your patients are on the sidelines ready to come in, those that haven't been in the clinic thus far?
Yeah, we have a lot of elderly patients that are in, let's say, assisted living facilities or a nursing home type scenario that come in. They've been restricted and they just can't wait to come in. Yeah, so we've got that group, and then we've got patients that they're really scared. And as soon as it starts opening up, they're gonna start coming back. So the first 2 weeks of March, we were doing very well. In fact, we were on track to have the best year we've ever had in practice. And in the last 2 weeks, we just went off the cliff. We're noticing as we're getting towards the end of April that things are starting to trend upward. In fact, today's a perfect example of that.
So Austin, one of your patients today happened to drop his motorcycle on his leg.
Yep, put it down on the side of the ditch, laid it right into his leg, came in hobbling, and so we took this ankle image, kind of caught some of the lower leg, and we can see the displacement right here.
Can you see it, Sophie? So that x-ray was up this morning.
Yep, just took it 20 minutes ago.
Things are going to start picking up. People want to come in. They need chiropractic care, they want chiropractic care, and they look for us to help them, you know, with meeting all of their needs and staying healthy. I mean, we have a patient-centered practice focused on outcome, and our job is to help them enjoy optimum health potential. If we're not here, it's not going to happen.
I'd like to make just a couple of concluding remarks on today's visit to the Burt Clinic. First, the Palmer campus clinics in Davenport are open and seeing outpatients during this COVID-19 crisis. We've adopted protective gear, screening measures for patients, and other precautions. In addition to the appointments in the clinic, we're counseling patients on self-care instruction through remote communications. Today, I thought it would be informative to visit what some of our alumni are doing and how they're getting along. Now, this is a low production video today. My daughter Sophie volunteered to take the footage with my iPhone and stitch it together later. I'm certainly appreciative of the Burt's time today. What a great example of how chiropractors are adapting their practice facilities and protocols to ensure patients have ongoing access to essential chiropractic care. They are promoting spinal health, And they're also coaching patients on the importance of movement, exercise, nutrition, sleep, stress reduction, and other factors of overall health promotion, including hand washing, social distancing, use of masks to slow the spread of COVID-19 specifically. And in this small community, they also play an important role as first contact for folks with a broad array of complaints. As we saw with the motorcycle rider who broke his fibula and presented to Dr. Austin Burt's practice this morning, Austin recognized the problem, confirmed the fracture on X-ray, and referred the patient to an orthopedist all within the time of about an hour. This is made possible by Austin's accessibility, his skills, and his relationship with other providers to facilitate that patient's care beyond other paths that patient may have taken to receive care today. So thank you folks for joining us. Sophie, thank you for all you're doing to help create the video. Folks, that's a wrap.